In this lesson, we'll begin taking a look at the bony anatomy of the lower extremity. We're going to take a look at the components of the pelvis, and then we'll focus on each one of the hip bones or coxal bones that make up the pelvis. So here's a diagram showing the pelvis in its entirety. You'll see here on this diagram, this would be the left hip bone. All of this here where my cursor is going, this would be the left hip bone. On this side, all of this would be the right hip bone, or we call it the coxal bone. You'll notice that the hip bone in the front on the right is connected to the hip bone on the left by a piece of cartilage. This is actually fibrocartilage known as the pubic symphysis. You'll see in the back the hip bone on the left here is connected to the hip bone on the right by the sacrum, right? So this blue bone right here is the sacrum, and then we know this little tailbone right here is the coccyx, and then the L5 would be right here, and then the vertebrae would stack up on top. Each hip bone is made up of three individual bones that ultimately fuse together like in our late 20s. So if you notice, let's look at this right hip bone over here. This kind of purplish part of the hip bone is called the ilium. This yellow part here is the ischium, and then the reddish part here is the pubis or pubic bone. Okay, I have them labeled over here for you: ilium, pubis, ischium, and then these three, 1, 2, 3, they make up the hip bone, or what we call the coxal bone. Okay, you'll also notice here this kind of V-shaped area of the pelvis is known as the pubic arch. Now this would vary in a male versus a female, right? In a female, this would actually be broader. In a male, it would be more narrow, right? And that's to allow for childbirth. It would be broader in a female. So here's a pelvis intact with real bone. So again, you can see here the hip bone on the left. And again, even though it is on your right side of the screen, this would be the model's left side. All of this would be the ilium, the pubic bone here, and then the bottom back part is the ischium. You'll also see in the hip bone there's a big hole. I have it labeled over here. This is known as the obturator foramen. So again, between the two pubic bones, in this model here, it's green. This would be the pubic symphysis. Now, I want to introduce a term right here. There is a socket in each hip bone. This is the first time I have it labeled. I'll go over it again. Since it's labeled, I'll talk about it. There's a deep socket in this hip bone, and the same deep socket in this hip bone over here. That is for the attachment of the femur. That socket is known as the acetabulum. Right? So that socket we're going to call the acetabulum. Again, here's the pubic arch. This is just a posterior view of the pelvis. Again, you would have the entire hip bone over here, the other hip bone over here, and now you can see it really well, the sacrum and the coccyx from behind. Right? And then we even have a little bit of L5 up here. So just a posterior view. So let's take a look. This is a view looking down into the pelvis from above, right? It's a superior view. There's a couple landmarks that I'd like you to know. There's an actual rim right here. This whole, if you just follow my cursor all the way around, all of this is known as the pelvic brim. Now, between the pelvic brim, this would represent the pelvic inlet. If you if this was a model, and just kind of where you go to put your hand into the pelvis, entering into the pelvis, this would be the pelvic inlet. Then if you pushed your hand all the way through where it comes out of the bottom, this would be the pelvic outlet. This actually has obstetrical ramifications as far as childbirth, right? If that pelvic outlet were to be too narrow, right, that could pose a problem. Now, this may be a little bit hard to see on this diagram. I'll show you another diagram in a minute. But the area of the pelvis above the pelvic brim, so if this was the pelvic brim right here, the area of the pelvis above the pelvic brim between this iliac bone here, and then we follow this black arrow here to this iliac rim right over here. This would be what we call the false pelvis, right? It would be above the pelvic rim, and all digestive organs would be sitting in here. So what we did here is we actually cut the pelvis so that we're looking into it. So watch this. This represents here the pelvic brim, right? This would be the pelvic inlet. If we were to put our hand into the pelvis, right, it would go through this red line first. Now we would be into the area below the pelvic brim. This is the true pelvis. The area above the pelvic brim, all this area here would be the false pelvis, not the bone. It would be the area between this hip bone and then in this case the left hip bone, which is not shown. Right? So the false pelvis is really this, it's like an area, this whole area here where my cursor is kind of going up and down is all going to be the false pelvis, and it contains mostly digestive organs. The true pelvis down over here is going to have more reproductive organs like the uterus in the female, the prostate gland in the male. In both sexes, the bladder would be here, the rectum, that type of thing. Right? So here's the pelvic brim. Above the pelvic brim, the region is known as the false pelvis. Below the pelvic brim, that region is known as the true pelvis. Again, if we were going to put our hand down into the true pelvis, we would actually pass the pelvic inlet. Now our hand would be in the true pelvis, and then if you push your hand through the model and push down, you would now exit through the pelvic outlet. So this is actually looking into the pelvis. Let's say somebody were laying on their back. Here's the sacrum, and it's almost like you were doing a pelvic exam. We could actually see the pelvic outlet right over here. All of this would be the pelvic outlet. They're kind of showing you the height, anterior, posterior measurement, and then the width. Again, depending on the size of this pelvic outlet in a female especially, that becomes important for childbirth. Right? If that pelvic outlet is not big enough, right, they may have to take a baby out via a cesarean section. We're going to look at these landmarks in a couple moments as far as the ischial spine. You know, the distance between this ischial spine here and that little ischial spine there is important. And the distance between the pubic symphysis and the coccyx is also important. And these are measurements that can be made on the ultrasound. So just a little bit of a difference between male and female. I'm not going to go through all of these. You can review some of these if you'd like to. But typically in a male, this is a male pelvis, the pelvic inlet is going to be more narrow. The pelvic outlet is going to be more narrow. The coccyx actually tips and is tilted into the pelvis. Again, so if a male was going to have a baby, right, those three things right there would make it difficult. The inlet, the outlet, and the coccyx would all interfere with the childbirth. If you look at the pubic angle over here, right, in a male, it's going to be less than 90 degrees, right, where in a female, let's look at the same three criteria. The pelvic inlet is going to be more open. It's going to be circular shape. So as the baby drops down in the last stages of their development, the pelvic inlet will allow the baby to go down towards the birth canal. The pelvic outlet is going to be wide, and the coccyx actually points down. It's actually straight down. It doesn't tip into the pelvis. And then look at the pelvic angle over here. Excuse me, the pubic angle. Right, it's more than 100 degrees, so the pelvis will be wider. So in the lab, when you have the two pelvises, lay them down like this and take a look like you were doing a pelvic exam into the pelvis, and you could definitely see the differences, right? Because we have both male and female pelvis in the lab. Okay, so let's take a look now at the three bones that make up the hip bone or the coxal bone. So I had mentioned earlier this deep socket right here is known as the acetabulum. This is going to receive the head of the femur. And you'll notice all three bones that make up the hip bone, the ilium, the ischium, and the pubic bone, all meet in the acetabulum. All right, so that deep socket is the acetabulum. So let's do this. We'll kind of draw an imaginary line here and take a look at the anatomy of the ilium. This is an outside view, a lateral view. The first landmark that I'd like you to find is this crest right up here that goes over the top of the ilium. This is called the iliac crest, right? It's big and it's thick, and this is where some abdominal muscles attach. If you go forward, the crest ends as a point right here. This point I abbreviated as the ASIS. That is the anterior superior iliac spine. So that's this pointy part here. Spines are usually pointy. Then if you drop down a little bit less prominent, this is the AIIS, the anterior inferior iliac spine. Go back to the iliac crest. If you follow backwards, right, there's a big bump right over here known as the PSIS, posterior superior iliac spine, right? PSIS. And then finally, this down over here is the PIIS, posterior inferior iliac spine. Right, so it may seem a little confusing at first, but it's not that bad. There's two spines in the front, two spines in the back, right? Hence the name anterior and posterior. One spine is above, that's the superior one, and one spine is below, that's the inferior one, right? Superior and inferior, so it's not that bad. The next landmark on the ilium that I'd like you to find is this big notch right here. This actually allows for passage of the sciatic nerve. The sciatic nerve actually forms in front of our sacrum inside the pelvis, and then it emerges through this big notch right here, the greater sciatic notch, and then it comes out about mid buttock and then it heads down towards your toes. So this is a big notch for the sciatic nerve. The last two landmarks we're going to see from the inside of the ilium. So on the inside of the ilium, there's a kind of a deep depression here, or I should say a shallow depression, but it's more than just a little shallow. It's it's quite a bit depressed. This is known as the iliac fossa. We usually define a fossa as a shallow depression, right? But it's a little bit more than shallow when you see it. Right? So they call this depression here the iliac fossa. And then the last landmark is known as the auricular surface. This is going to be the portion of the ilium that articulates with the sacrum. And if you remember from the sacrum lesson, there's an auricular surface on the sacrum, right? So the two auricular surfaces go together. Okay, so again, the things you need to know: iliac crest, ASIS, AIIS, right? Anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, the greater sciatic notch, the iliac fossa, and the auricular surface. Now, back from the acetabulum going posterior, all of this here, this is going to be the ischium. The first landmark of the ischium is this point. It's right below the greater sciatic notch. Since it's pointy, they call it a spine. This is the ischial spine. Then there's a less impressive notch here called the lesser sciatic notch. Then look at this big chunk of bone here. This is, if you're sitting right now, this is what you're sitting on. We actually sit on the ischial tuberosity. Okay, so that big chunk of bone is the ischial tuberosity. This hole right here in the hip bone is known as the obturator foramen. The floor of the obturator foramen is actually two bones united together. So we're going to look at this bone here. I drew a dotted line. This bone posterior to that dotted line is part of the ischium, and we call that the ischial ramus. Think of a ramus as like a branch, just like a projection. So this here is going to be the ischial ramus. In a couple seconds, we'll see that this is going to be coming from the pubic bone, so this is going to be one of the pubic rami, or a pubic ramus. Okay, so there's kind of imagine like an imaginary line right there. So this big hole right here is the obturator foramen. The floor of this hole here is two bones united together. The posterior aspect is the ischial ramus. Right, so the landmarks you need to know: the ischial spine, the lesser sciatic notch, the ischial tuberosity, the ischial and we're mentioning now this hole called the obturator foramen. The last bone that makes up the hip bone or the coxal bone is the pubic bone. So the pubic bone has this main portion here. It's known as the body, right? So this is the body of the pubic bone. I put the pubic body there. On top of it, there's a little round knob, a little round bump. This is called the pubic tubercle. Now, extending from the body, there is two rami, right? Two rami. This ramus that goes down to meet the ischial ramus is the inferior pubic ramus. Okay, so now we have the whole floor of this obturator foramen, and then coming from the body, there's another ramus, right, another branch that forms like the ceiling of the obturator foramen. That is the superior pubic ramus, right? So there's two rami. Rami is plural, extending from the body. One goes down, inferior pubic ramus. One goes kind of up and across, forming the ceiling of the obturator foramen. That is the superior pubic ramus. Okay, so body, tubercle, and then one, two rami. The top one is superior, the bottom one would be inferior. Okay, and then the last slide for this lesson. Here we're just seeing the pelvis from the front. Here's the pubic bone. Again, you can see the body right here. Right, the bump on top is the tubercle. Again, this would be the inferior pubic ramus right over here. One more time, this bend right here is the pubic arch, and the last thing would be the pubic symphysis. So that concludes this lesson on the components of the pelvis, especially the pelvic brim, the false pelvis, the true pelvis, the pelvic inlet, the pelvic outlet, right? And then we took a look at the anatomy of the coxal bone or the hip bone, where we looked at the ilium, the ischium, and the pubis, and all three bones united together at a deep socket known as the acetabulum.